Good evening, everyone. My name is Francesco Zambon. I'm speaking from Venice in Italy. I'm the coordinator for Healthy Settings and the coordinator for Regions for Health Network and the Small Countries Initiative. I was asked to chair this webinar, which I'm doing with great pleasure. This webinar, which is live streamed. So in addition to almost 200 people that we have connected now, this is also possible to see, to view this webinar through the website of WONCA. And so we are very excited about that because it's a live event. This webinar is on family physicians and the COVID-19 pandemic on the way forward. If I can ask everyone, please to mute the microphone so that we make sure that the quality of the sound is good. The webinar is organized by the WHO Regional Office for Europe and by the World Organization of Family Doctors. And we have the pleasure to have the opening remarks by our WHO Regional Director for Europe, Dr. Hans Kluge, and also by the President of WONCA Europe, Professor Dr. Mehmet Ungan. We are very lucky to have them both here to open this webinar for us. And then just to say a little bit about the structure of this webinar, there will be two speakers, one by Dr. Natasha Azzopardi Muscat, who is the new director of the Division for Country Health Policies and Systems of the WHO Regional Office for Europe, and then one presentation from Professor Thomas Frese, WONCA Europe, who will be speaking from Halle. Then this will be followed by questions and answers that I would like to ask you to channel through the chat so that I can read them to the speakers and direct them accordingly. And I really hope that there will be a live discussion because, I mean, we know how important and how essential was the role of family doctors in the management of the pandemic, COVID-19 pandemic. And also we know, unfortunately, the very high price also in terms of human lives that COVID-19 took on family doctors. And so I think that having this webinar is also a way to honor them and to make sure that something that happened during this first phase of the pandemic is not repeated in the future. With no further delay, I would like to give the floor to our Regional Director for Europe, Dr. Hans Kluge. Hans, I cannot see you, but I'm sure that I'm going to see you as soon as you start speaking. Hans or Paul?
Sebastian, you need to unmute the regional director.
Yes, let's mute the regional director. That's very important. Can you make sure that the regional director is unmuted?
Sebastian, you have to unmute the WHO Copenhagen RD.
We are working on it. There are so many participants, so it will take a few seconds.
Yeah, now I can hear you. The regional director is one of the last in the list, Git.
So just give me the green light, Francesco, when you would like me to start.
Now we can see you and we can hear you.
Okay, excellent. So thank you, Francesco, and dear Professor Mehmet Ungan, President of WONCA, all colleagues. It's a great pleasure for me to be here, and thank you for co-organizing this webinar. I hear a bit of an echo. I don't know also hear this echo?
Yes, I can hear the echo. Can we please mute all microphones? Can I ask again everyone to check that the microphone is muted? I understand that there are more than 210 connections, but we need to make sure that everyone is muted. Sebastian, can you, or Gitte, can you mute?
Me? Yes? All right. So, thank you so much again to Professor Mehmet Ungan, all the colleagues for making this webinar possible on a better and stronger primary healthcare in times of COVID-19. You know that WONCA is a very, very precious partner. For me, I became the regional director in February, almost coinciding with the COVID-19, which badly hit our region, the WHO European region. So learning from the past and looking to the future, this is indeed a right time to reflect on how to fully realize the potential of the primary healthcare for better responding now and in the future. In fact, I was just finishing the video conferencing with the Minister of Health of Bulgaria, who also put the question forward on the second wave. So here what we're going to do at the regional office is not to wait till the pandemic ceases to do a after action review, but to do what we call a in action review. So in case there is a second wave in the fall, potentially combined with seasonal flu, that we can give already policy recommendations to the member states. As Hippocrates once said, better to prevent than to cure. And what we have seen in several countries is that where there was a strong primary healthcare oriented health system, that those systems were much more resilient. The whole pandemic also revealed, of course, that preparedness and readiness was relative. We thought that some countries with a quite strong health systems were prepared, but ultimately were quite fragile, and as Francesco was mentioning, led to a quite high death toll, which of course we regret very much, and I would like to convey also my condolences and empathy to all the communities who have lost beloved ones. It is not surprising that we also have seen during the response a rise in mental health problems, including also in healthcare workers. One of the topics of my weekly press briefings recently was also on the increasing rates of domestic violence. In the WHO European region, 1 out of 4 women faces some kind of domestic and intimate sexual violence domestically, and 1 out of 3 children. And we know that in any kind of emergency, this increases. And we do have also data from the United Kingdom. But perhaps the hardest hit by the pandemic we have seen in the elderly people and the vulnerable populations, including also in facilities with children with mental disabilities. So this again underscores the importance of being prepared at a level of care of first point of contact. My vision is called United Action for Better Health. It's the European Program of Work. Maybe I will repeat that one because I think someone was trying to call me. So the Vision for Health for Europe is the European Program of Work, United Action for Better Health, which is aligned with the Global Program of Work. And it has 3 priorities: moving towards universal health coverage, preparing for emergencies, and health and well-being. And primary healthcare is transversal. There are 4 flagship initiatives, and those initiatives came out of my marathon campaign. As some of you know, I was the only one of the 6 candidates for these positions who managed to visit all 53 countries in 4 months. And the following 4 priorities came back time and again: mentioned by the Ministries of Health. Mental health, and the idea is to launch a mental health coalition, and there I have the support of the Queen of Belgium, who is a SDG, Sustainable Development Goal, champion on mental health. The second flagship is digital health and innovation. The third flagship is immunization 2030. And the fourth flagship is on behavioral insights. And in fact, unexpectedly, through the COVID-19 response, those four flagships have been tested and are becoming even more important. Many of you know that there is what we call GDO. A GDO stands for Geographically Dispersed Office, like a center, a regional center of excellence. Like we have such a center of excellence in Venice, where Francesco is based. We have such a center of excellence on primary healthcare based in Almaty. This center, before I came into the office, has been a bit dormant. A top priority, which I committed to the ministers, and particularly to the Minister of Health of Kazakhstan, my good friend, Dr. Yerzal Bertanov, was, if I'm elected as the region director, this will be my top priority. And I am very proud, in all modesty, to inform you that despite of the COVID-19 response, I did keep the timeline to have a selection process. And last week, I appointed Milita Jakob as the new head of the GDO Primary Healthcare Center in Almaty, who has a long experience working on the field, including on health systems and non-communicable diseases, working with many of you, like Professor Jan de Massenier and other ones, on hammering out the vision of primary healthcare. So I'm keeping the word and moving fast forward. Finally, we have seen no one is safe until everyone is safe. And the stronger primary healthcare we have, the stronger health system, the stronger health, and the stronger social cohesion, which has shown so important in those challenging times. Thank you so much for the opportunity, and I'm going to stay throughout the webinar to listen and learn from all of you. Thank you.
Thank you very much, Hans, for these very powerful remarks. And indeed, I mean, the beginning of your mandate unfortunately coincided with the beginning also of the, I mean, in Europe with the COVID-19 pandemic, but that also is, so to say, an opportunity to show how important the World Health Organization is, and to have a strong organization and to have a very strong common vision as the one that you presented, which is underpinned by primary health care. And I know that part of your campaign was also a very strong call for partnerships. And I'm very happy that this webinar is organized together with WONCA. And that's very important, I guess, key stakeholder, the key stakeholder for family physicians. And with pleasure, I'm going to now give the floor to Professor Dr. Mehmet Ungan, who is the president of WONCA Europe. Professor Ungan, you were before connected, and so I hope to see you now on the screen.
Yeah, I'm here. Can you hear me?
Very well and clear. Thank you.
Okay. So, dear regional director, dear Hans, can I say dear Hans, because many of you know him not much before that he was the director, general director of the Europe. He has been in our many sessions, in many conferences, supporting the idea, and has been working with the primary healthcare very closely. The regional director Hans and the colleagues, I'm happy to be together with all of you. I know many people are now watching. I have seen from here that the numbers are increasing continuously right now. And also in our website, I see that more than 500 connections. They are trying to hear what Hans will say. Actually, this is very important messages, including. And I would just say that there is an article published online platform, Fatigue, the name, so I wouldn't be too much keeping in view, but I have to say some items. With this pandemic, I think the world understood that all nations and sectors shall come together to overcome such a big threat and disaster. We have to be together. There is certainly a need for coordination of emergency action, even for a pandemic preparedness plan exists for many countries. We still need it. For those which are not having a plan, the condition should be more worrisome, I think. You know that if you do not have a plan, it may only be called as a wish. It's something, it's not a target. So we have to have the plans. But this is very important. Those countries who has the plan could react immediately. The World Health Organization, in the face of the pandemic, plays a very critical role in addressing many areas of health and well-being, including the social determinants of the health, non-communicable disease prevention, communicable disease elimination, and moreover, mental health promotion and post-traumatic stress disorders is now an expected condition in the primary health care. I'm talking about the primary health care. So maybe due to losses, damages in their family life, financial and emotional consequences of it, in addition to an intense physical work, which cannot be counted as a simple condition just passing by. It will certainly have effects, and we have to be prepared together with the WHO. And we are taking care of the health of our registered patients, families, and a whole population with our team members who also put their lives into this fight. And I have to mention that Dr. Donald Lee said, "We are the first in, and we will be the last out in this pandemic." Many countries arrange applause at night by the public for the health professionals, but many countries as well forget the day of family doctors, which was 19th of May. I personally felt jealous when Australian government sent greetings and appreciation for the family doctors in all visual and printed media, which we already saw. I felt sad for some countries that family doctors work without personal protective equipment, not because they already had but did not prefer to use, but they were not provided, like in Italy and many others in primary healthcare settings in early phases. I felt sad about for those who got COVID-19 and those health professionals and became a patient. And when they were on sick leave, they were not paid. And the families, children of those primary healthcare workers and health professionals generally, who lost their lives when they were trying to protect the public health and their patients, I think we have to be really, as you say, we have to be sad. But we have to do something also. I'm sure that with the memorandum of understanding signed by Donald and Dr. Tedros is more meaningful now, more than ever. Collaboration shall be touching the base level now, as well as the higher levels. I would encourage the WHO to advance all countries to include the family doctors into all decisions when fighting with this and such pandemics, which may not the end or not the last one. That is correct also for the non-communicable diseases for the future, besides the infectious diseases, of course. Family physicians are willing to participate into all decisions related with the public health so that the important work of WHO, especially near-term COVID-19 treatment and vaccine research, can continue more healthy way for the populations. Our true knowledge in general practice and family medicine coming from science and research in the primary healthcare, which makes us powerful. We will be happy to support and use this power on behalf of other countries, all countries, under the lead of the WHO Europe also. Thanks to Dr. Kluge, who had a great contribution in our all conferences. He will be in Family Doctors Europe Conference in Berlin coming, and he will give a speech which I am eager to follow, like all of you. I think you are also very eager. I would also like to Dr. Cihan, country coordinator of the Northern Macedonia. I think still she is there. who planned this event, who offered this event actually to happen for celebrating the Family Doctors Day originally, together with our regional director and the team members of the WHO Europe, which we appreciate really, and with my frontline colleagues who really want to say a lot but cannot reach to such higher levels. They are very happy to hear you in that level, and I'm sure it will be a useful meeting now for all of us and for the public health of the WHO Europe region. Thanks to our speakers and to you all for being here, showing your sincere intention to collaborate with. Thank you.
Thank you very much, Professor Ungan, and indeed, a special thanks to Jihan Tawila for promoting this idea from the very start. Thanks from Venice to North Macedonia. As you rightly said, Professor Ungan, family physicians paid a high price in this COVID-19 pandemic. Just in Italy, there were 167 doctors who died, and more than 1/3 were family physicians. Indeed, as you mentioned, also the lack of PPE, but family physicians also play an important role, as we have seen in Italy, at least, which is the country where I'm speaking from. They can play a vital role in keeping patients at home. So for early treatment, for the detection, of course, of cases, but also because they are close to people, close to the vulnerable populations, and also because they have that human touch and the human aspect that they can have with all the patients. That's really unique to the family physicians. That's why we call them family physicians and not like just doctors. And now I would like to give the floor to the friend and colleague, Natasha Azzopardi Muscat, in her new capacity as Director of the Division for Country Health Policy and Systems, WHO Regional Office for Europe. Natasha, I guess that this is one of the first public event. Now it's with a large event, because we heard that there are many people following the streaming live so we are about 1,000 here in your presentation now. And I am personally very much looking forward to hearing from you and to always hear your inspiring thoughts. The floor is yours.
Thank you very much, Francesco, and thank you, dear Hans and dear Mehmet. It's been a pleasure to listen to you. And in the coming few minutes, what I intend to do is to illustrate how the primary care physicians not only play the vital role during the COVID crisis itself, but how they continue to be so critical as many countries in the European region are navigating through the transition period, and furthermore looking forward into the coming months as we try to support the countries to recover both economically, socially, as well as the health sector, and at the same time strengthen our preparedness, because we know that we need to be better prepared in case there is a second wave in the fall. So I will start. Can I have the next slide, please? So I will start just by echoing what has been said by my colleagues, that we know that those countries with a strong primary care system were able to keep patients out of hospitals, where unfortunately often we saw that patients were exposed, and hospitals often served also to accelerate the disease. So for those with very moderate symptoms, the fact that they were able to be in contact with their family physician often was key, particularly for those people who were more vulnerable, to keep them safe and well looked after in their homes. And I think that this has been a key principle, has been perhaps undervalued and underreported because it is not so well captured in the statistics. And just to say that, so my thoughts are with you and with the families of those colleagues who have unfortunately passed away as a result of being dedicated to treating their patients. Next slide.
Well, Natasha, just 1 second. May I just ask our colleague in Copenhagen to mute everyone and to unmute only Natasha, because there was a bit of background noise. Thank you. And sorry, Natasha.
Okay, good. Thank you. I think that one of the areas where looking forward, we need to consider how to strengthen the ties also is between primary care, family physicians, and nursing homes and long-term care. There were some countries where the nursing homes were unable to get the support and care that they needed early on. Where nursing homes are well linked with the family physician and primary care system, the care that is required, the advice and the support can make a huge difference. Next slide. So I would like to start off by explaining the way in which we have considered the transition and managing the transition. And you can see that we divided it into 4 quadrants. The first one is to do with surveillance and control, very much the public health measures of testing and tracing and isolation. The second quadrant refers to health systems management, the third to population behavioral insights, and the fourth to the social and economic recovery. At the heart of all of this is the data analytics, the communications, and the governance. And primary care has a very key role to play in all 4 quadrants. Next slide. Next slide, please. Starting with the public health measures, the surveillance and control, primary care, family physicians had a very important role to play in identifying people who should be referred for testing and swabbing. Not only identifying, however, a strong role also in persuading people who may be afraid or reluctant to get tested, also fearing COVID stigmatization. So the role of the family physician in identifying and in persuading people to get testing is key in the success of any testing strategy. However, what we have seen also is that in a number of countries, because the public health workforce was not large enough to be able to implement the testing and contact tracing required at scale, many primary care services supported the public health service in order to be able to rapidly scale up testing and contact tracing. Again, I think one of the key lessons that emerges here is that it is very important for public health services and primary care services to work hand in hand together, not only during a COVID pandemic situation, but also keeping the strong bond now as we go beyond. Next slide. Move now to the behavioral insights. When we talk about behavioral insights, what we mean is the way in which the population understand the communications from authorities and respond and behave is what ultimately determines the R factor, the disease transmission. Over here, primary care doctors play a crucial role in translating that guidance, that high-level risk communication, both at an individual level to families, as well as within the communities where they are often so well trusted and respected. And furthermore, some family physicians have also contributed immensely by appearing on the media and speaking in the language that they are used to speaking to their patients, such that complex public health measures are translated into a language that is easy to understand. They also act as very important sources to receive feedback. How are people and communities receiving the measures that are being suggested and implemented by the authorities? Family physicians are very well positioned to provide this immediate feedback, which is not feedback that is gained through surveys, but a different kind of feedback, a qualitative and immediate feedback through their associations and representations back to the authorities. Next slide. When we navigate the transition, it's a very challenging moment. On the one hand, we need to make sure that we remain always alert to be able to ensure that if there is any resurgence in COVID infections, we control them quickly, immediately, and thoroughly, because we do not want the experience of the first wave to come back again. And therefore, we know that we have to have part of our work, which is still very much focused on COVID-19, on learning the lessons, as Hans said, even if necessary, learning whilst doing, and in ensuring that we have this ability to have a flexible and elastic response. But perhaps more importantly at the moment is to recognize that there is a lot of disease out there and pent-up demand that has occurred because the routine health services have not been able to function because either they were shut down or they were overwhelmed or patients were afraid to come forward. And therefore, it's really now the moment to redouble our efforts to ensure that we catch up with immunization, to ensure that cancer screening appointments that may have been missed are rebooked. And over here, again, the family physicians have such a key role to play in ensuring that these elements of the service are up and running, as well as in persuading their patients to seek care for symptoms that are urgent and require care that cannot be delayed. Unfortunately, in some countries, we have seen also that a rise in mortality was not only associated with COVID, but with avoidable conditions just because people were either unable to access services or afraid to come forward to receive the necessary care. I think one of the powerful lessons that we have learned from the pandemic is the importance of really transforming our health systems in an efficient way and building on primary care. Next slide. The past weeks and months have seen a number of major transformations implemented in record time. And in primary care, one of the major changes that we have seen, for example, is the deployment of virtual and online consultations, as well as remote patient monitoring. Now is the time to take stock, to understand what has worked, what has not worked, to keep what is good and build on it, to improve efficiency, to reduce burnout, and to embrace innovative models that allow family physicians to complement digital technologies. I think there is a microphone that needs to be muted. And next slide, yes. And one of the areas where moving into the recovery process, primary is definitely going to see an increased workload, is as a result of the financial and economic crisis. We know from our experience of the crisis 10 years ago that we can expect to see an increased demand for services related to mental health issues associated, for example, with precarious employment or loss of jobs. We know also that even children, for example, who have been away from school, particularly those coming from vulnerable families and difficult home conditions, have experienced adverse reactions that may stay with them for a while. The family doctors are going to be the first ones to recognize these issues and therefore to be in a position to move forward. And I think this is really also the right moment to think of the competencies and skills that our family physicians are going to need to have as our health systems are likely to undergo transformation as a result of what has been experienced because of the COVID pandemic. Next slide. I think it is key at the moment that we regroup, learn lessons, and strengthen our preparedness for a potential second wave if it does occur in autumn, at the same time as we will be seeing the common cold and influenza. Next slide. And finally, if you visit our website, you will be able to see that we have published a number of products, many of which are very practical and that can provide you with support, but also to work with your local authorities on planning surge capacity, if this should be required, on how best to maintain essential services during a time of crisis. And forthcoming, in the coming days, we also hope to add the primary healthcare specific COVID guidance as one of the products. It's really been a pleasure and opportunity to share these thoughts and reflections with you going forward as we navigate together through this transition process. And we look forward also to cooperating in the coming months as we learn lessons and build stronger. Thank you.
Thank you very much, Natasha, for this inspiring presentation and thoughts and reflections. And actually, while you were speaking, there were already comments coming in, and you already addressed some of them, like the need for virtual tools to assess them and to make them available broadly. And also one of the comments was about public health physicians. I just wanted to mention that there have been a number of webinars, I mean, not this one, but in the past weeks, where we focus specifically on the role of public health physicians as well, in addition to family doctors. I just wanted to ask everyone to channel all questions and please try to make the questions short so that we can take as many of them as possible through the chat, and then I will direct them to our speakers. And in the meantime, I would like to give the floor to Professor Dr. Thomas Frese, WONCA Europe, who is speaking from Halle. Professor Frese, yes, I can now see you, yes. The floor is yours, and you also have the presenting rights, so you should be able to, yeah, we can see your contents now. Thank you.
Yes, so thank you very much. Good afternoon, colleagues. It's a nice opportunity to speak here and to give some thoughts and maybe impulses about the way forward of family practice, family medicine in this corona pandemic situation. What did we face during the last months in general practice? In the first phase of the corona pandemics, we faced a lack of some things like protective gear, but also like information, leading to a high uncertainty. Further on, we saw heterogeneous situations through practices in Europe regarding the workload, with some practices lower workload than usual, other overwhelmed in regions with high COVID incidence and then prevalence. Some of us GPs were facing limited contact to subgroups of patients because patients not coming into the family doctor's office because being afraid of COVID infections or limited contact to patients in nursing homes due to visit restrictions and to protect these groups which are high at risk of a severe course of COVID infection. Healthcare providers, not only family physicians, all healthcare providers were in a diverse role. We have to give care. Family doctors are on the front line, are the first points of contact, are very important for their patients. But some of GPs, family doctors, are also on their own at a very high risk. And we have also to consider that family doctors and practice teams and other healthcare providers may be super spreaders of COVID-19. What we further saw during the last weeks and months was new approaches and regulations which were quickly implemented into practice. It was already mentioned with regard to telemedicine approaches. It is hard to say where we are now. Is it the day after? Are we in the acute phase of the pandemic? What will happen next? As it seems now, we have a currently controlled situation in most regions of Europe. The number of active cases are dropping. We have more or less good availability of diagnostic testing capacities, mainly PCR. We see that some countries reduce the measurements which were taken to control COVID pandemic during the last months. Some countries even celebrate this as the end of the pandemic, but still, located smaller outbreaks seem to be one of the main problems, especially outbreaks in nursing homes, in hospital, especially outbreaks in younger patients, which may be often with just small symptoms, not very sick, hard to detect. And we may face, as it was already mentioned, a second wave, which could come because the factors, the environmental factors and their role on COVID spreading is not fully clear. And we have to take into account the possibility that during a next wave in the autumn or winter season, we will see mixed infections of influenza with COVID, of other viruses combined with COVID in the same patient or in different patients, and this will bring much more unclarity in the situation. What will be, or what could be, the way forward? How will COVID influence our work, our working style, our behavior in family practices? It can be assumed that the workload, which was lower in some practices during the last weeks, may come back to a normal state. Also, as a minor indirect problem of COVID, some independent practices in different European countries may face economic difficulties. What was mentioned in the current review is that the effects of COVID on healthcare providers, especially on healthcare providers in the primary care sector, is still unclear. It was shown that for many healthcare providers, stress, anxiety, and depressive symptoms increased during the corona pandemic, but primary healthcare providers were hardly included in this in these studies. Further on, through the further months, very likely protective gear and different behavior than until now will be necessary if we see certain patients in our practices. Also, consultation hours and working days will have a different structure. For example, likely we will have to separate possible infectious patients from the others in our practices, a thing we have not done in a very consequently way before. And this may also affect and have influences on the relationship between family doctors and their patients. The way forward during the next time will further be influenced by the implementation of technical solutions. which replace face-to-face consultations and which also will help us to separate suspected COVID-19 positive persons or patients from other persons or patients. And this may help to stop spreading of the infections. This is a trend. This is currently pushed by the felt need, but also, of course, by the industry developing such solutions. For example, we saw also with the webinars that industry pushed this and used this current situation. In many health systems, the barriers to use technical replacements for face-to-face contacts were reduced. So the work in family medicine got a kind of organizational flexibility during the last weeks and months. And it was shown, and it's plausible, that telemedicine facilitates patient care and mitigates and indirect COVID-19 effects. If you think about giving care to chronically ill patients which do not want to come to the practice, it's a kind of monitoring. Of course, it is difficult. You cannot touch the patient. You do not have that direct interaction with the patient which you do have in the consultation room. It is really different. But we should also take care and have a look on what happens to regulations, and if situation with Corona further improves, that the wheel of implementing and using innovative approaches will not be turned backwards. We should also see that COVID, as hard as the situation was and is, could be a kind of booster for innovations and for flexibility and for improving healthcare and family medicine for our patients. The tasks which GPs will have to take during the next weeks and months will be to deal with health problems which were not addressed, which were unmet during the last months regarding diagnostic and therapeutic procedures. Also, we will have to cover up with unmet preventional needs. We will have to handle with psychosocial side effects of isolation, like domestic violence, depressions, anxiety, and so on, as it was also mentioned before my talk. And a huge burden of diseases can be expected from the socio-economic crisis, which now will come to many European countries and which will lead to mobility and increased need for healthcare. Okay. So I have to see, I cannot. Also, the way of testing for COVID-19 will have to be reviewed, and maybe some new thoughts have to come in. First, family doctors should be more heard if new concepts for diagnostic testing are planned, because, as also mentioned before, public health services were too weak, had not sufficient resources to react and to do broad testing. In some European countries, family doctors will have a key role in testing, whether they want or not want, they have a key role. Also, a testing of healthcare providers, including family doctors, has to be planned to avoid that family doctors could spread infections. Overall, the test capacity may be further enhanced by new diagnostic tests or by pooled testing. Pooling samples to enhance test capacity or to reduce test costs to be more efficiently with test costs is to my thought, not sufficiently considered as a possibility now. We have to come to a situation where large-scale testing should be possible if we aim to eradicate COVID-19 from our populations. And also on the agenda of the way forward for family doctors and family medicine should be some more research in the context of COVID-19. Hardly any of the published literature with findings in this field do consider primary care. It is unclear how long-term strategies could be and could work to deal with COVID in the population, likely for the next year, for the next 1.5 years, or even longer, and this will only work with family physicians. A kind of sentinel and testing strategy with the help of family doctors, as I already mentioned, should also be developed, and we have clearly to think about, because we saw that general practitioners got sick from COVID and many died, how to reduce the risk for family doctors and the primary care practice teams. This also again in the light to avoid that primary care teams, family doctors, other healthcare providers spread COVID infections. The indirect effects of COVID have to be assessed, and we have to describe what resources will be necessary and take the lead in dealing with it. Retrospectively assessing the effectiveness of measures which have been taken in the past to control COVID will be important, together with other scientific disciplines, to be well prepared if a second wave or third wave of COVID will hit us in the future months. In summary, it has to be stated that COVID did hit us unprepared, despite the scenario could be expected in some way. It will change our personal and professional life for a certain period. And currently, family doctors are underrepresented in decision-making process and research activity, despite they have a key role in dealing with COVID outbreaks and consequences directly and indirectly of COVID outbreaks. But please be also positive. We managed all together as the family, as the community of family doctors, together with other players in the field, COVID-19 as good as we could, and also see it as a kind of chance and as a facilitator of bringing innovations into family medicine and into patient care. Thank you.
Thank you so much, Professor Frese. I can see that there were very many points of contact with the presentation also of Natasha, basically. And I like the positive note that you said in the end, and also during your presentation, that COVID could be really a booster for innovation. And we need to try to be also see a positive side of it. While I am encouraging every one of you to pose very brief questions, otherwise we won't be able to read them all through the chat. I would like to ask whether our regional director or the president of WONCA would like to make any comments at this point, because I guess that they might have other commitments. So I wanted to ask Hans whether he wanted to have any comment at this point.
Thank you, Francisco. I really enjoyed both presentations, and I will try to stay a bit longer to listen to the questions, but I would like to underscore both what Professor Ungan and Professor Frese were telling about the tremendous appreciation to the healthcare workers, social workers, frontline workers, and at this occasion, particularly the family physicians who indeed were on the front line. That I'm, as many of you know, a family doctor myself, and I started as a practicing family doctor in Belgium. And I always say I am a lucky man in the sense that whatever job I did, I always did it with heart and soul and with big pleasure. But if I think back at my time as a family doctor in the fisher village of Lombardije in Belgium, was one of my best times because you have the trust of the people. And this is something I am very concerned about, the erosion of trust of the society in the public governance. And you see that in those times, private sector is becoming empty because it is the public sector who leaves no one behind, or and the family physicians there and the social workers are at the front line. So definitely today, tomorrow, the next 5 years, I'm very much looking forward how to accelerate the implementation of the Astana Declaration on Primary Healthcare. I like very much what Professor Ungan told. He said, something without a plan is only a wish. You can count on me to work together on a very concrete action plan. Thank you.
Thank you very much for this inspiring quote, Hans. You always have very inspiring reflections. Professor Ungan, do you have some reflections as well after Natasha's and Thomas' presentation before we go to questions and answers?
Yeah, I think we have, as I said before, we had a very good lesson right now. And I think we know what we have in our hands. And in the last 3 months, we had an experience, which is, of course, I can't call it an experience only, but also we have an experience right now about how to proceed, especially in online consultations, the legal issues, and how is the patient, how the patients will be included in the decisions. And I mean, there are a lot of items that we have to discuss, and slow by slow we have to solve. There are some questions, what I've seen. What is they are asking, our members are asking, you know, what is the expectation? Do you all think that as the WHO, the second wave is most likely, or is that a kind of probability? For example, one of the questions is this one. And the other one is, I think, very important for us to know that I think those family doctors who are practicing should be a little bit, primary care service should be protected by not allowing direct contact of any suspected COVID-19 patients with or without symptoms. Contact should be made virtual, otherwise there will be a major source of spreading the infection while they are, you know, providing essential services to the non-COVID patients. So this is an important item which is mentioned by Professor Salman Rawaf also, which I agree. I think we have to talk about those kind of services that should be separated maybe in the primary health care also. I mean, and also another very well question, which I know is, you know, how shall we understand the patient? Actually, those people, some of the people are coming to us in the practice for other reasons. And then we discover that it might be a COVID patient because they don't have typical, how do you say, symptoms or typical things, you know, they don't have fever, for example. But then you, for just a coincidence, you take an X-ray for another reason, or job reason, for example, occupational reason or something, and you see this, you know, and then you realize that. So it is not easy for the primary healthcare workers to, because we are just really having the contact immediately to understand how to understand. It should be something. A tool maybe could be developed in the WHO primary healthcare team. Maybe it might be a kind of helpful point for us also. And for the other issues, you know, integration of the primary healthcare in all aspects, in all the medicine is really talked about, you know, for many, many years, and slowly the primary healthcare is being integrated to everything. But I think it should be integrated into public health very well. This is very important. Um, those are the things that what I would like to say. But I think the sound of the primary health care should be heard, by the governments. This is very important because this is the hands of those decision makers. But if you have the direct connection in between the decision makers and those who are touching the base to the public, it would be, I think, the nicest solution for all of the public health. That's what I am saying.
Thank you very much, Professor Ungan. And I think that indeed, as Professor Frese said, that COVID is a booster for innovation. COVID is also a booster for primary healthcare because everyone is very much aware of the role of primary healthcare now, probably more than ever. Natasha, I have a question for you from the comments. I guess that's one for you and one for Professor Frese. One question for you, Natasha, is about the different practices which were adopted in the different countries across WHO Europe, with substantial differences in outcomes also, in terms of practices which were adopted by family physicians. Is there like a review plan of such practices, or maybe some kind of guidelines which will be issued also in view of a possible second wave or for future pandemics, like a kind of analysis of practices across Europe to see what worked and what could work better in the future?
Thank you, Francesco. I would like to just mention, you are well aware, that in the midst of the crisis, as WHO Euro, together with the European Commission and the European Observatory on Health Systems and Policy, we set up the Health System Response COVID Monitor, which now, as of yesterday, is also available in the Russian language too. And these basically are bringing together a series of country profiles that are documenting the different experiences, including the role that primary care has played. I think it is quite clear to say that those countries that not only had a strong primary care system, but that were able to integrate the efforts of the hospital, the primary care system, the public health services, and the long-term care system in a way, were able to tackle the problem better. As Hans mentioned earlier, one of the things that we would like to carry out is what he is calling an in-action review. So yes, we are trying to draw upon the case studies and examples that we are collecting from around countries to understand what appear to be promising practices or innovative practices that could allow us to be much better prepared going forward. The first time round, we could say, with all honesty, that we did not know anything about the virus and that we found ourselves in this uncomfortable position of having to take decisions with very little data. Now we have more information, so there is no excuse for not being better prepared. At the same time, we are also dealing with a situation where people are very tired, where some degree of COVID fatigue starts to set in. And therefore, what is likely to be a realistic scenario is that it is going to be very much up to us as leaders in the healthcare sector to come up with what needs to be done and what could have been done better. As WHO, we are not there as such to pass judgments, but always to stand ready to support. And the regional director is regularly convening ministers of health, chief medical officers in small groups and also in larger groups to offer, to listen what kind of support we can provide and to offer. we issued on transitioning, because it was very practical and very timely, was actually well received, because health authorities were able to use it as a tool, also as an instrument, when they were working with the office of the Prime Minister, ministers of finance, etc. I think it is time going forward now that also we put all our heads together to understand how we can manage more precisely without resorting to very blunt instruments like huge lockdowns, which have their own side effects, not only for the economy, but also for the health and well-being of the population too. And to try to understand how we can be more focused and more targeted. And what the final word that I would say here too, also, because I know that there were some comments on public health. As a public health physician myself, I think one of the key lessons that we have taken out is that the public health workforce needs to be very close also to the clinical colleagues, working very much on the upward determinants of health, linking very much with the economy, with education, with social policy, but on the other hand, having one arm which is really working hand in hand with the clinical colleagues. And I think that is something that we will want to emphasize as WHO Europe going forward. And thank you very much for this opportunity to start building this bridge in my new capacity here too.
Thank you very much, Natasha. And now I would like to pose a question to Professor Frese, and asking both of you if we can try to give shorter answers so that we can pose more questions. The question is about, there are two questions about COVID and influenza. And to Professor Frese, what is your idea about the situation in the winter with possible second wave of COVID plus influenza at the same time? And how will it affect family doctors in particular? Do you have a clear idea on that?
To be honest, I do not have a really clear idea. The main problem, of course, will be we have two viruses which can be combined in one patient, and or which can be one patient with influenza and one with COVID, but both patients with the same nearly the same symptoms. So I think in generally in the winter season, testing will increase, and it will be a challenge for general practice. And also the way of testing may change, because we may more go forward to multiplex PCR. As far as I know, to the best of my knowledge, regarding COVID in children, for example, if there were severe cases, it was mostly combined infections, meaning that you do not have to check just for COVID, but also for other viruses causing upper respiratory tract or lower respiratory tract problems.
Thank you very much, Professor Frese. And maybe a question to both of you, or also to the regional director or the president of WONCA, whether they want to intervene on that. It's about, one comment is about 4 of 18,000 comment articles are about primary care. So very, very few countries respond pandemic through with primary care. Why is it so? And also, why do you think, there was another question, governments decided not to rely so much on primary care, or maybe it was a de facto situation that, we are facing now with previous disinvestment on this sector. Do you have a comment on this? Or how to also foster, to take the momentum for more investment in primary care in the immediate and medium and long-term future?
Can I comment?
Please.
Yeah, I know that question is going around. A few times we have discussed, but I think we don't have a very good answer for that. But I can tell you the observations, because it's not an evidence-based answer. And those observations in some countries, in order to publish in the primary healthcare, you need the large data. and the large data is not provided to the family doctors by the governmental, central governmental organizations who keeps the data. This is putting us in a difficult condition in the training also. You know, we have to understand in which subjects we have to forward our, you know, or maybe just adapt our trainings also. In this pandemic, the same thing is happening. So in order to get the data, we could only see the data from the government, who is telling the data on the televisions and also in the WHO website we were following, you know, in our own countries also. And this is one of the major things that we cannot go to the data directly. And in the primary healthcare, it's not easy to make a publication, which is more like it's easier to make a publication retrospectively, but still you need the data and the permissions. So this is a kind of a part of the answer. It's not a whole answer. This is a part of it. The second thing is, I think, the government, I don't know why, but the governments usually do not, do not act together with the primary healthcare workers, professionals, in such kind of actions. It is seen like, you know, you have to do that. That is all. You know, they give it to you and you have to do that. But it's not the case, because what we have been observing in primary healthcare is really useful for the decisions, you know. So in this pandemic, the same thing happened, I think, and mainly the hospital work started. But without the inclusion of the primary healthcare in a correct way, it would not be successful for sure. Now, I think I don't have a clear answer, because I know that in many countries, the conditions were a little bit different than the others. The Nordic countries relied on the primary healthcare more than the others. And those are all related with the policies which were developed locally, as I see. This is not a real answer, but at least a contribution.
Thank you, Professor Ungan. And maybe because I'm aware of time, one last comment from the speakers and also from Hans and again, Professor Ungan, about the involvement of family physicians in future pandemic preparation programs. So is there a plan for that for the future, like how to better involve from the start, or for better training also in future pandemic preparation programs? Is there already a clear plan? I mean, this might be a burning question for Natasha, who has just started in her new capacity as director, but maybe you have already an idea, or maybe the regional director might want to intervene on that. And also Professor Frese for just one last comment on this, which I guess it's a nice way to wrap up and also seeing this into perspective of the future and how to be better prepared. Natasha, do you want to start?
I will start, Francesco. Just a very brief comment. What can the family physicians do to help us prepare better for the fall, when we might have influenza too? Is so already to promote very heavily from now the influenza vaccination. So just a plea from our end to all of you, because you are well positioned. And then I think the answer is that yes, typically with emergency preparedness, I think countries often tend to gravitate towards the hospital, the emergency physicians, the ITUs. And I think that this pandemic has shown very clearly that we need to be working much more at the primary care level too. And I think there will be ample scope to consider also the core capacities that we need to have in place as defined in the IHR. And that could also be an opportunity to understand how to transform also the role of primary care going forward when we come to review the lessons learned and understand what can be done differently, what can be done better. As Hans said, if I'm not sure if he's still with us, and the European program of work is called United Action for Better Health, and partnerships and building partnerships is a key element. WHO cannot do it all alone, but we can convene people, the best people, the experts, those with the experience on the ground, and listen to them. And this is the mode that we would like to adopt going forward. Thank you once again.
Thank you, Natasha. Hans, I don't know whether you are still connected. In case you want to intervene, please just make yourself heard, and of course we will give you the word immediately, the floor. In the meantime, may I ask Professor Frese about these pandemic preparation programs? What do you think that can already be done on these regards to be better prepared for the future?
Yes. Of course, being prepared is most important, and from my personal perspective, it was a kind of being disappointed since the general scenario of a new virus spreading was expected and in a way expectable, and was also a manner of some political plannings already years ago. And what we've seen is we had not enough protective gear, as I mentioned. So we should act on these issues and get the resources to be prepared. Of course, a kind of training for family doctors may also play a role, but I think many of the work was already done by training on the job, learning the hard way.
Thank you very much for this comment. And one last word, maybe because I know that Hans left the meeting because he had other commitments, but we were very grateful to have him for the entire duration of the webinar. Professor Ungan, do you want to have a final word on that, maybe on an encouraging word and a reflection for the future?
Yeah. I think whatever we do, we are just one-to-one with the patients and the healthy people also, and we are taking care of a lifetime our patients, and even we have to be careful about the environmental health, and environmental monitorization should be done by the health systems also in order to warn us for earlier. Under the preparedness issue, actually, but that's kind of public health measures. But also in the family medicine, I think we have to be building a very good network in between the organizations, like under the WONCA Europe and WONCA World also, and also to link the academic departments under Europe, in the Europe, if we are talking about, just to be really having a standard training on some certain issues, and to have a more beautiful collaboration, better collaboration with the sciences and to join the data in order to have a better outcome. And I am very happy that this is something that Hans already mentioned. We are lucky right now that somebody who is a physician who had an experience in the family medicine is now directing the WHO European region. And you have been collecting us for the last 2 years in many primary healthcare activities under WHO Europe, and you are inviting us and just asking in expert meetings. And we try to learn in the last 2 years how the WHO is working. It's not easy for us to understand the style of the outcome of the joint work, but now we are talking in the same level, I think. So that means as much as the WHO wants us to be including in the plans and not only pandemic, but preparedness plans also, we will be very happy to join, because it's really touching to the base. When we are there, then if we are understanding if it will be useful Or if it's not useful, then we can immediately at the beginning tell you that, okay, this is a kind of plan which will not be effective in the primary healthcare for this and this and this reasons. So this is important collaboration, and we feel lucky. I really appreciate all the work done by Jihan, and especially on behind, also a team was there. I can't remember all the names, but technical team and also all the primary healthcare team. I have seen from here that from Slovenia, from many countries, those people who are really carrying the responsibility of the primary healthcare under the WHO in those countries, they are all here, what I have seen from them. I appreciate for their contributions. They don't talk right now, but I'm pretty sure that they are taking notes and they will come with another meeting. Maybe if it's possible to collect those questions under some item, and then if we all together can answer to those questions to those people who asked, it would be very nice not to leave them without any response. But I think this is the way how we are used to in the webinars. Thank you very much for a very nice conduction of this meeting also. Thank you.
Thank you very much, Professor Ungan, and I want to thank you. I want to thank WONCA for leading on this. Of course, our regional director, Dr. Muscat, and Professor Frese as speakers. I would also like to thank Jihan, as you already mentioned, because she was really a driving force for that. Also, Anne Johansson from Almaty. And then from the technical side, Gitte, Sebastian, Paul, Sam Petri, when you put together a webinar with so many people, then it's always, it requires a lot of preparation. So I would like to thank them all. And indeed, there will be an emailing list of all who participated in this webinar, so it will be possible to share the presentations and also the questions. And I do hope, as it was mentioned at the beginning, that this is just a good beginning, a good start, and I was again very happy that our new director of the Division for Country Health Policies and Systems could have the opportunity to share already her ideas on the way forward with such a large audience. So I would like to thank all of you for being with us, despite the fact that we went far beyond the time set for the webinar. And till the next appointment, I would like to wish you all a very good evening. Bye-bye. Bye.